Exploring endoscopy, a closer look inside. Understanding endoscopy. Endoscopy, minimally invasive exam of digestive tract and internal organs. Uses thin, flexible tube, endoscope, with camera and light source inserted through mouth, nose, or anus for visualization of gastrointestinal or respiratory tract, among others. Reasons for endoscopy. Endoscopy diagnoses and treats gastrointestinal issues like ulcers, inflammation, bleeding, tumors, and abnormalities. Enables tissue sampling, biopsies, polyp removal, bleeding cessation, dilation of narrowed areas, and therapeutic interventions. Types of endoscopy. Endoscopic procedures target specific body areas and medical issues such as upper endoscopy, e.g., colonoscopy, sigmoidoscopy, bronchoscopy, and cystoscopy. Each aids healthcare providers in assessing and treating conditions effectively. Procedure overview. During an endoscopic procedure, the patient receives sedation or local anesthesia for comfort. The endoscope is inserted into the body cavity, enabling real-time visualization on a monitor. Benefits and risks. Accurate diagnosis, targeted treatment, minimal recovery. Risks: perforation, bleeding, infection, anesthesia reactions.